Welcome to another fantastic interactive section on Main TV. My name is Divine James, and today we'll be talking about halitosis. And with me to do justice to this fantastic topic, I have Dr. Dosunmu Fatima Kemilola from the Lagos State University Teaching Hospital. She will be telling us everything that we need to know about halitosis. So stay with me. Let's go talk to our amazing doctor. We'll be right back. All right, welcome back. We are still talking about halitosis, and it's my pleasure to introduce to you our beautiful, delectable, amazing doctor. She's been so friendly since we came here, and she's been trying to see that everything goes on successfully. Thank you very much, doctor, for having us.
It's my pleasure to host you.
I really appreciate you. Thank you so much.
You're welcome.
So, how long have you been a dentist?
I've been a dentist. I say it's over 20 years. Let me just put it at that.
Oh my God,
I've been in this for over 20
Over
years.
20
Yes.
years. Wow. So how's it been like? How's the experience been like?
It's been beautiful. Dentistry is about putting smiles on people's face so that you can shine your teeth. So it's been a beautiful experience, to treat people and appreciate you, and you see the outcome of the treatment and you are happy and they're also happy. So it's been quite rewarding.
Nice. I like it when people talk about what they do with so much passion. It gives me so much joy to see that. All right, so today we want to talk about halitosis. Can you tell us the origin of halitosis, how it all started and what brought about it?
Well, the way you put it, the origin of halitosis, I won't, halitosis, it's got from the word halitus, breath, and osis, any medical condition, you see osis, it's just a condition. So, simply put, it's malodor. It's been there ever since man existed. So, talking about origin, it's been there. You understand? It's been there. It's just that the word or that halitosis later, from those combination of words, people having bad breath. It simply means bad breath.
Okay.
So it got from the word halitos, which is breath, and osis is a condition, any condition. So that's what brought about that. So it's been as long as man has been in existence. Halitosis has been there. It just simply means bad breath, or simply put, oral malodor. That's another word. There are so many synonyms.
How do I know if I have mouth odor?
Thank you very much. You will be surprised that after dental caries, which is the cavities people complain about that gives toothache, and the gum problem, halitosis is the third most common complaints of patients that come. So you have, I would say, it could be objective and it could be subjective. Objective in the sense that, probably you licked the back of your wrist and then you smelt it and you have an offensive odor, or something like that. Or that's you can say that is somehow objective, at least. Then some people is from feedback from people. That's feedback from people. I will tell you that, I think maybe there's something you ate, or telling you in a stylish way.
Is it possible that you have bad mouth odor and you don't know that you have it?
It's very, very, very possible. If you have, even the sense of smell. Some people it's more will I say more developed than others. Some people can smell very well, some people cannot. And even if you have nasal infections or ordinary common cold, you might not be able to. In fact, I would tell you that the people that really have malodor don't know they have. It's from people's reaction. Maybe they've been told by loved ones Do you understand? That maybe makes them aware, or some people, even reaction of people to them, they perceive it as, oh, people are reacting a kind of way when I talk, maybe trying to dodge me and all that, and they take it as malice. So it could be objective, it could be subjective. Okay. Do you understand? So for the subjective, is usually being told by loved ones, people that are close to you. And when I say people that are close to you, really telling you that, coming out to tell you, not just the reaction, because people mix it up. Some people just assume that people's reaction to them, because most of the cases we see, they just say that at work people don't really communicate with me so well, and I feel I have a bad breath. But it has to, apart from the reaction of people, you have to be able to objectively determine. Objective means that find out if it's really there. Okay. By some measures. Okay. Which is I'll make mention of some of the ones that we use in the clinic. Okay. We call it organoleptic methods. That is using your nose to actually perceive and feel and see if the halitosis is there. There are different ways. How is that done? Yes, I'm coming to that now. There are different ways we do that. Okay. You know, I might have to remove my face mask. Actually, when I see patients, I use my face mask. For that particular, I need to, and then come close to the patient, like 10 cm to the patient. Okay. At times, it could be through, you can tell the patient, there are some, we don't have the screen here, but in other clients, they have a screen so that you won't be embarrassing the patient. Okay. And then there's something the patient blows through, and you perceive from behind the screen. Okay. You know? And then maybe a distance of 10 cm. You understand? The tube is actually to prevent the odor from diffusing, so that it's directed straight to the physician that wants to perceive it. Okay. Another means is that you can ask the patient to lick that's the tongue, okay, the wrist, and then allow it to dry, and then you perceive and see if it smells.
Okay, so if you have mouth odor, that automatically means that your saliva also smells, or your saliva also is affected by it.
Yes, saliva is one of the causes of halitosis. If you don't produce enough saliva, or if saliva itself is a fluid and it has components. Okay. If there are some components of that saliva that is missing, like we have some microbial agents inside the saliva. So if you are not either producing enough of that saliva, or you have some of those antimicrobial agents are not the saliva, or they are deficient, then you can have malodor. So there are different methods. I was even just coming, they can incubate the saliva, you know, and find out if it's the organisms. There are organisms that so there are different methods. There is a Banner test, which uses an enzyme linked assay that you know, the bacteria that are there. So it's either they can take the saliva, they can use it, or they can take plaque. Plaque are some of these debris around our teeth, can also be used. So it's an enzyme linked method. So they can also use the saliva, but we can also the hair from the mouth when the patient blows. So the hair too, the saliva too can be used. The debris inside the mouth too can be used for that Banner test, which is an enzyme linked assay method.
All right, guys, you have heard it. We will go for a short break. When we come back, we'll be talking about the cure, preventive methods, and other things that you need to know about halitosis. Welcome back. If you're just joining us, this is Main TV, and my name is Divine James. We are talking about halitosis. So we want to talk about the cure, the preventive method, and other things that we need to know about halitosis. And with me, we still have our beautiful doctor in the building. All right, Dr. Dosunmu, let's talk about the cure. Can we cure halitosis? Can it be cured? What are the measures that we have to follow to make sure that we get it treated? Because I know that for everybody who has this problem needs a solution to it, because it's very embarrassing where you're talking to somebody or your colleague in the office, and the person is giving you that, and you just notice that everybody's trying to avoid you. Nobody wants to have a conversation with you, even when you know you are an amazing person. So you will be wondering, and I'm sure everybody wants a solution.
Exactly.
So how can we go about providing solutions?
Halitosis is a very, very condition of social concern, because it affects a lot of relationship, and you can find out that a lot of patients come, they are anxious, some are depressed, and to start with, it can be cured. It can be treated, it can be cured, but you need to know the cause. So I would want to start from that angle.
Okay.
That is, when somebody presents to us in the clinic, we first assess the patient, evaluate. So I started from how we evaluate the patient. We need to objectively determine, is it even there? And then we need to take some history. There are a lot of causes of halitosis.
Okay.
So in the means of taking history, you can decipher some of the things that could possibly cause. So such history, like you take since when have you been having the halitosis? Do you have cough? Do you have catarrh? Do you have ear infection, the ear pain? You try to look for things that would cause. So we take a history, even take medical history, because there are some medical conditions that are associated with halitosis. Okay. The malodor might not even be coming just from the oral cavity, can be coming from the GIT. We have so many openings or systems that are linked to the mouth. The nasal passages linked to the mouth, the GIT, even the ear. So if you have ear infection,
it could come out from your mouth.
If you have foreign impaction in the nose, it could come out. So you need to take a very good history.
So that is to say that some of the smells that comes out from the mouth is really not halitosis per se.
Some are from 80% to 85% are from inside the mouth, and then we call it intraoral causes. Those causes that are resident in the mouth, and then we have the extraoral, which are the other ones. Then we have systemic conditions, that as a result of that disease condition is why the patient has one of which is diabetes mellitus, which produces a kind of acetone breath. They have their characteristic smell. Even liver disorders too, gives this kind of fish odor smell. Do you understand? So you need to take a lot of medical history, dental history. You look into the mouth before you even talk about the system. You look into the mouth. Does the patient have enough saliva? Like I was talking about, saliva is a major thing. It has a very important role in the mouth to maintain the oral integrity.
Okay.
The saliva is very, very important.
Okay.
If you have low saliva production, you are going to come down with even some infections in the mouth. Some fungal infections like candida. So you need to examine the mouth, find out that the patient doesn't have oral infections. Make sure that the teeth, if you have callus cavities and you have food packing into those cavities, they're going to smell. If you have, your teeth are not well aligned, maybe they are at an angle and food is trapping in between alignments of teeth, can cause halitosis, because the food debris will be packing and after a while it starts smelling. Do you understand? You could have restoration. Some people are wearing maybe dentures, and maybe they are not caring properly for the dentures, or they are not removing it at night to clean it, before such things. So you need to first look into the mouth, look for things that can possibly cause the halitosis, see if they are present, and then before you also look at other from the history. We also do a systemic review.
Okay.
Check all this. Check all the systems of the body. Take history of the different systems of the body to find out that they are not systemic conditions. So after doing that's in evaluating the patient, you now arrive at the type of halitosis. There are types of halitosis.
Okay. So how many types are there?
Okay, there are different classifications. There is no definite classification. Some have classified it this way, some have, but I will just use a simple one for the purpose of this interview. Okay. So I will just say, we'll say genuine halitosis and then delusional halitosis. Genuine halitosis is that I've looked into your mouth. Yes, I've been objectively found out that you really have oral odor, made by some of the means I've earlier talked about. I've been able to establish, and I've been able to find out the possible cause in the course of my taking history, review of your system, examining you and all that, So I've been able to determine that it's really there, and the cause, I've been able to identify it. That is genuine halitosis. Then we have the delusional halitosis, which is the one I talked about. It's not that you are perceiving the halitosis, but the reaction of people to you is what is making you think that, oh, I think I have mal odor. Why is this person trying to cover me? Why is this person trying to avoid me and all that? So for delusional halitosis, we just don't say, oh, it's not there. After, objectively we try to determine, we can't find it objectively, then maybe we look at, okay, one or two things in the mouth that could possibly be causing it, and then we assure the patient. If the patient has one or two curious teeth, we try to restore the teeth to make sure. If the patient is not taking enough or not producing enough saliva, we ask the patient to take enough water, rehydration, and all that. And then if ill-fitting dentures, you make a good denture, tell the patient to care for the denture and all that, how to clean the teeth if you have poor oral hygiene or you have tongue coating. Another important cause is most people don't brush their tongue, and the tongue is not smooth. It has what we have called papillae. That's where the taste buds are. So debris, if you don't brush the tongue, debris can pack and hide in between, and that smells a lot. And that is when you tell some people to bring out their tongue, you find this whitish debris. It's actually organisms are there, epithelial cells, a lot of food debris, remnants of food and all that, So that is usually at the posterior. You don't see it in front. It's the posterior part of the tongue. So we call it tongue coating. So depending on how heavy that tongue coating is, can cause. So we tell the patient there is something we prescribe for them. I'm still going to come to that. So even like I said, some people have postnasal drip. If you look into the posterior pharyngeal wall, you find that there are mucus at the back, which is also a possible cause of the halitosis. There are the tonsils at the side. They can have some calcified materials too. Call it tonsil stones. So there are so many things inside the mouth. So having taken care of every other thing and reassuring the patient, and the patient is now fine, and is not bothered about it's not bothered about the people's reaction, because he now knows that there is no mal odor. That is pseudo halitosis. It's not really there, and the patient knows it's not there because every other thing that is supposed to be taken care of and everything is fine. That is pseudo halitosis. It was not there objectively, and the patient now knows that it doesn't have it. But there is this other part of delusional halitosis that it is not there. Every other thing, in fact, some of them have superb oral hygiene. Their mouth is totally clean, but that person has he just has this opinion that he just has this halitosis. It's fear. We call it halitophobia, fear of halitosis. So that one is
there are people who actually suffers that?
Yes, we call it a psychosomatic symptom. They are what we call psychosomatic symptoms. They are symptoms of they're psychological symptoms that manifest physically. It's not only halitosis is one of them. There are so many of them that are psychosomatic problems that could come up in there. But halitosis is one of them. There are other ones. So if you're able to determine that, okay, you're taking care of every other thing, but this patient is just obsessed with the idea that he or she has halitosis. And then we also have some surveys or questionnaires that we use, assessment tools that we use to ascertain that this patient has a psychosomatic symptom. And for those kind of patients, we co-manage with the behavioral medicine, because they won't benefit only from our own side. So there are different treatment modalities they use, counseling and all that is being done for them.
So if you have this phobia that you have halitosis, you can actually go through
therapeutic
sessions and all that.
Yes.
Why? Just because I have fear that my mouth is smelly?
Such people, they can't function, you know. They are depressed. It's a psychological problem.
Wow.
It's a psychological problem. They can't even do anything. You know, if you lose your confidence, it's not something that is easy. Some of them will even abandon their work because they are just obsessed with the idea that people are looking at me, people are not, and
so even function. After so telling they them, need help. Even after telling them that they don't have
they won't believe you. They are not going to believe you, and they keep on moving from one center to the other center and being so they done this for me. In fact, before the patient sits on their chair, he would start telling you, I've been here, I've been there, I've done this, I've done that.
So at what point will such a patient believe that he or she doesn't have it? Finally,
that is the behavioral medicine when we refer them, but we just don't leave them to. In fact, some of them don't even like to go. They don't like to go because of the stigma in this in our climb. They believe that once you send them to that side, you are probably telling them that they are not okay. So they don't even like. A lot of them will decline. They will say they don't want to go. So there was a time that we had to invite somebody from that department to help us see them right in our clinic, so they will know that it's still part of the management.
They are psychologically okay remaining in the dental section.
But they don't want you to tell them because they believe immediately you tell them to go, they are probably telling them that they are not okay so because of the stigma in this environment, that anybody that goes there means that you're not
okay. All right, so now let me ask, what are the ways that you can treat this situation? Is it only by English medicine, or there are other traditional ways to treat this condition, given the fact that the economy now is so hard, and then buying medicines and all that is, is very on the high side? So are there other means that people who have this halitosis can, treat it and don't have to spend so much on medication?
There are ways to treat it. Like I mentioned before, there are different causes. So it's actually the treatment of the causes. So you have to identify what is causing it. If I identify that, you have upper respiratory tract infection, of course that is what I'm going to treat. Do you understand? If I find out that you are not producing saliva, even some medications that you are using for other conditions can dry up your saliva. And I need to refer you back to your physician to look into those medications and probably give you alternative to the medication. Or I might need to tell you one or two things to help you stimulate more saliva. Just like you have seen, it's not everything that is medicine.
Okay.
At times we prescribe sugar-free gums. Xylitol chewing gum doesn't have sugar. Anything when you chew, you stimulate saliva. So something to help you
produce more saliva.
They also, depending on from our assessment, we might prescribe saliva substitutes for the patient. You have some saliva substitutes, or in the case of drug, if the glands are not secreting, are not able to secrete, we also prescribe some medications for them to help stimulate the saliva. So it's actually the underlying cause. That's where I'm coming to.
When you made mention of substitute saliva, my head is telling me fake saliva.
No, they are combinations. They are put together.
Okay.
Things that are constituents of normal saliva that God has given us.
Okay.
So it's artificial saliva.
Oh,
it's let's put it as artificial saliva. So it contains those lubricants, mucin, and things that will help you remineralize the teeth.
Okay.
They are put there. So it's a form of artificial saliva.
Okay. All right.
Artificial saliva.
So are there I mean, I know you medical people are in the medical line, they really don't like to talk about our traditional herbs and
well, they are I won't say herbs, I would say home remedies,
like say like our local chewing stick or local herbs. Can they help?
Chewing stick will also, chewing stick can help.
Okay.
Too, but you need to chew it well, and then the top, there is the flared top is what you can, and you use a normal brushing technique. It's not just using the problem with using even with toothbrush, you need to use a good toothbrush technique. Some people just brush like this, not going to do anything. You're packing the debris in between your teeth. So the important thing is
bringing them out,
telling them how to even use the chewing stick to clean. There are some, I know they have some herbal constituents that help the gum and all that, so it's fine. But I won't tell them to substitute it for the toothbrush. They can use it as a supplement in addition to the toothbrush, because the toothpaste that is being applied on the toothbrush has fluoride, which the chewing stick will not have. So they can use this as a supplement to the toothbrush, but with the toothbrushing technique, the proper toothbrushing technique to take out the debris in between their teeth. So that's very important. And there are some home remedies like baking soda dissolved in water. Can be used, cinnamon, for those agents are actually, some of them have antibacterial agents, and then some of them also help to mask the odor. So I would say they are adjuncts. I would take them as adjuncts to because what we are treating in halitosis is the underlying cause. Do you understand? So those they can use both as adjuncts to the medical treatments.
Alright guys, we are still on Main TV talking about halitosis. Let's go for a short break. We'll be right back. Welcome back guys. My name is still Divine James, and we are still talking about halitosis. And we still have our Dr. Dosunmu in the building. She has been educating us a lot about halitosis. So right now we have some questions that has been sent in, and I would like to know what the doctor's takes are on this topics that have been sent in by some people that have been following us up. Hello doctor, So I read somewhere that you shouldn't rinse off your mouth after brushing. I tried it, but I haven't been comfortable since I did it. Now the question is, what is your take on this, doctor?
Yeah. Okay. Thank you very much. Yeah. So there are sometimes we advise some people, depending on the severity of dental caries they have. You know, there are some that we find out that they are prone to having carious lesions, and so we want is a kind of fluoride therapy we want to do for them. And then so for such patients, we apply fluoride in their dental feces and toothpaste, and then we tell them to spit out the toothpaste, not to rinse it out. So it's a form of, in that kind of case, it's a form of treatment, a form of therapy. Okay. For that. So the not necessarily rinse out, but for the regular person that is brushes twice daily, there is really no need. You can after brushing with the toothpaste, you can rinse out. But so it depends. I would say it depends on the severity, because ingestion, I wouldn't advise you to, especially the kids. You know, we even advise them to use peanut size so that they don't ingest the fluoride. So it's because there's something that is called fluoride toxicity as well. You know? Okay. So there's a maximum, even in the toothpaste, they have the levels of the quantity of fluoride that is in them. So because ingestion of the fluoride too. Okay. So I would advise that, depending on the severity, if the person is prone to having carious cavities, for those kind of patients, we advise them that, okay, keep it there for a while, then spit out. But for the other ones, you brush twice daily, you are good to
What about people like us who brush once a day?
So yeah, the advice is for you to brush twice a day, the last thing before you go to bed, and then to have your regular dental checkup, also twice a year, every 6 months.
All right, so there's another question here. It says, can some type of toothpaste also cause mouth odor?
Well, there are different kinds of toothpastes, but the one we recommend are the fluoride containing toothpaste. I'm aware that there are different herbal toothpaste around, and there was a time that we were really having issues with some of those herbal toothpaste, because some people react to some of those constituents. There were some people that were coming with darkening of their mouth, the mucosa, that's the tissue and the mouth. There were some that were coming out with burning. They start saying they're feeling peppery sensation, some ulcers and all that. And depending on, some can have drying effects of the mouth. And once you have anything that dries up saliva in your, you're definitely going to have halitosis. So I would say some, not the conventional fluoride, some of those other toothpaste with different constituents might also be responsible. So there are some that we tell to discontinue those kind of toothpaste.
Okay. All right. So another question here says, can regular intake of antibiotics cause halitosis?
Yes. There's actually something we call antibiotic stomatitis. Stomatitis is inflammation of the tissues in your mouth. When it becomes red, inflammation, painful, red, might be bleeding, inflammation caused by prolonged broad spectrum antibiotics. If you use it for a prolonged period of time, it kills all the normal flora that are supposed to be resident. There are resident flora in our mouth that they sort of balance, keep a balance, suppresses the fungal, they all coexist in the mouth, but it's just that they shouldn't be at a higher level. They have so we call them normal oral flora. So if you try to kill those normal oral flora that keeps the other ones in check, those other ones will now
Okay.
So you can now start having fungal
More like
infections.
killing the good bacteria, leaving the bad one.
To grow, those one will now overgrow.
Okay.
Exactly. So you can now have what we call antibiotic stomatitis. So it's a kind of fungal infection caused by prolonged use of broad spectrum antibiotics, not even only antibiotics, some steroids too. If you use them topically in the mouth, they can also cause.
Another question here says, can mouthwash kill or cure cure halitosis?
Yes, and we also say there are mouthwashes that we prescribe. So it depends on the kind of mouthwash you are prescribing. We prescribe some antibacterial mouthwashes depending on the indication for those mouthwashes. Understand? There are oxygenating mouthwashes as well. If you have some anaerobic infections, you can prescribe oxygenating mouthwashes. But there are some, the ones that we tell patients to keep away from are the alcohol-based mouthwashes, which is what we have in most of all these over-counter, pharmacy. That is what they have in stock. The alcohol-based mouthwashes, they can cause that because they have a drying effect on the mucosa and
so there are some
mouthwash
that can cause it, and there are some that can cure, help cure it.
Use in treatment.
Depending
on the indication.
So the alcoholic ones, they are most likely going to cause you halitosis.
Yes, because they have a drying effect on the oral mucosa.
So another question here says, what would you say to someone who has lost her confidence due to halitosis because I feel I have a mouth odor?
Yes, that is a very, in fact, it's something that it requires expertise. It's not just telling the person, it's convincing the person. So it's not an easy task. That is why we are professionals in life. So for me to be able to convince you that you don't have halitosis, I must be able to show you objectively, and for you to believe that I can't just tell you that I've checked, it's not there. So that is where the tools come into. We have something that we call halimeter. Because the halitosis is what we perceive. Some of them are volatile sulfur compounds, sulfur emitting. The organisms in the mouth break down our food, or amino acids in our food, and produce these sulfur compounds which smells out. Do you understand? So these halimeters, they are sulfide monitors. They help you to quantify. That is something I can show you objectively. This is an instrument that would help to check, are you producing these gases in your mouth? So it's something that I can use and show you. Do you understand? So it's not just telling them, it's showing them objectively that they don't have it, and telling them one or two things that they could do to improve on their oral hygiene, and counseling them and convincing them that they do not have this halitosis. But like I said before, they are the category that have the psychosomatic symptom, which is halitophobia, which you might need to refer. So the behavioral medicine would take it off from there. And
so last question from people. It says, can halitosis be transmitted?
Oh no. That's why the first question you asked me, that's when did this start? Halitosis is not transmissible.
We need to know.
What you can transmit is organism in your mouth. Some people are fond of, they carry your baby. A lot of people do it. They start putting their mouth and playing with baby and putting your mouth. You are transmitting what you have in your mouth. Yes, it's common sense. Some people will say they are kissing baby, licking the baby's mouth. So you can transmit the organism in your mouth
into the baby,
that baby's mouth. and then maybe cause infection depending on the organism. If it's a viral, the patient can come down with viral infection. Maybe you transmitted a virus into that baby, then the patient, baby starts having something like an acute viral infection that babies usually have due to viral infection, and then they start having bleeding gums, and of course the baby will have halitosis. But that doesn't mean that you transmitted is the virus or infection, not that it's halitosis that has been transmitted. So halitosis is not transmissible, but what can cause it can be depending on the kind of lifestyle.
Okay. All right. So you, from the beginning of our conversation, you made mention that halitosis has been from the beginning. I mean, from the first day that humans started existing. Now you also talk about babies. Now this brings me to ask: if you give birth to a child, can you give birth to a child that has halitosis, or they come out like that and then in the process?
No, you can't give birth to a baby with halitosis.
Okay.
But like I just told you, you can, depending on your lifestyle practices, kissing and all that, or the kind of idea. Some people have babies, they will not clean them. They believe that.
Because I was going to say that there are some babies that their mouth, if you go close to them, their mouth smells.
You have to clean their mouth, even as babies. But we recommend, there are things that you have to clean, even their tongue. Clean the tongue, clean that. But you use soft bristled toothbrush to clean. As long as they start having teeth, you have to clean. Whether it's just two standing teeth, you have to clean those two standing. And there is something we call nursing bottle caries.
Okay.
Some people will put most of these baby food, they're actually sweets.
Yes.
I think they have sugar in them, and then you prepare the baby, and because you don't want the baby to disturb you, you just put it in the baby's mouth, and she starts bathing the two teeth the baby has with sugar, and before you know it, they start having caries. Do you understand? So it depends on the practice. If you do a thorough oral hygiene for the baby, clean the mouth, clean the tongue, whether it's just two erupting teeth, they still need to be cleaned up with soft bristled toothbrush, the small one, and then peanuts, very little of fluoride to protect. So it depends on your lifestyle practices.
Okay. All right. So now let's say I have someone I'm in love with. I like this guy, but he has a mouth odor. How do you advise me? I mean, of course I cannot say no to him because he has mouth odor, right? When there are solutions, so how will you advise me to live with this person? Because there are people that they are struggling with their partners. Their partners have mouth odor, but for sake of respect, tradition, culture, and you don't want to disrespect someone, you don't want to make someone feel bad and all that, how do you advise I manage the situation with my partner?
Thank you very much. Some of the patients, I'm now talking about the patient, I'm still going back to, you can also play a role in assisting the patients to get better. As in feedback, there are some of them, after treating them, we now tell their spouse and ask for a feedback from the spouse that, okay, can the spouse still smell? Your first role is, if you identify it, referring the person to the right quarters to get help is one of the ways you can help. Then also the feedback I'm talking about. After the person has gone, you need to have a feedback and see, okay, if you are close to the person, it's still there, it has reduced, and you understand. So those are the kind of roles, feedback, and also maybe referring the person to where he can get help. So that is, having the right information is important. If you have the right information, if you are well informed, you will be able to advise accordingly.
That's nice. I mean, this your response goes practically to everybody who has friends and loved ones
Exactly.
that are suffering halitosis. Because I don't see any reason why I have to say no to a man who likes me and who is a good man simply because he has mouth odor. I know how bad mouth odor can be, but since there are ways that we can manage it and handle it, of course, it's a yes for me.
You can't be saving the person, because for all you care, might you even have underlying medical issues, and then so you'll be able to sort that out. Having looked at patients, if you find out that there's an underlying medical, and this this foul smell is actually coming from within the system, then we refer appropriately.
Okay, so there's this old phrase or traditional phrases that they say, that I don't know if it's superstition, but they say that some people who have mouth odor is because when they died their previous life, they did not. You must have heard of something like that.
No, actually, I've not heard about
that they did not wash their mouth properly when they died the previous life, and then the same thing applies to people who have body odor. Do you believe in
No, I don't believe in such. Like I said, there's the genuine halitosis is really there, and the causes is what has been highlighted. It could be causes in the mouth. It can also be, like I said, even diet. Some people make use of garlic. Some people eat it raw as medicines.
Okay.
Garlic. What's this other one? Even onions.
Having that amazing conversation with Dr. Dosunmu on halitosis. She has told us a whole lot of things that we need to know about halitosis. So right about now, it's been an amazing conversation, but we need to go. Yeah, we really need to go. So doctor, tell us in your last words your advice to patients who are suffering from halitosis. That's one. And secondly, your professional advice to young and upcoming dentists, because I know, trust me, I know the journey of professionalism is a whole lot, that at some point you just tell yourself, I'm done. And another point, you tell yourself, if I'm done now, what will I be doing? I have to live for something. It keeps going off and on like that. What's your advice to young dentists?
Okay. All right. My first advice to people suffering from halitosis is that they should go to the right quarters. They should go to the first port of call is your dentist. You need to visit your dentist twice a year, every 6 months, for routine dental checkup. That is where they can, help you prevent halitosis in the first place. Pick up things like dental caries, or restore some of the or if you have fillings there and they are not well made, they can restore your teeth to function, if I can put it like that. And then also your dentist can refer you if it picks up halitosis, and they send you to somebody that would be able to manage you. Refer you maybe to the oral medicine clinic, where you can be properly followed up and managed appropriately. So that my advice is that they should seek help from the right quarters. Some people just move from one herb to the other. I wouldn't advise that.
Okay. So and then
my last word to the upcoming dentists, oral medicine is a good area. Not so many people are even aware of this specialty, and it's a very interesting field, and where it's basically managing patients with oral infections, oral conditions, non-surgical management of oral conditions. So it's a very interesting area, and very fulfilling. So I will advise the upcoming dentist to also look in the area of managing some of these conditions so that we can help the community at large.
So much. Thank you. I really appreciate having you on the show. God
You're
bless you so
welcome.
much.
The pleasure is mine. So I'm able to, at least some people are interested in our field, and
Yes.
it will also educate. But so many people are not aware that some sort of management exists. They just believe that if you go to the dentist, it's either to fill your teeth or to extract, but it's way beyond that. So I'm happy somebody has picked interest in our field. So thank you for having me.
Thank you so much. All right, guys. So we have come to the end of this amazing conversation with Dr. Dosunmu, and you know what you know now, right? So make sure you take care of your teeth, you take care of your mouth, so that we all can have a better community. Thank you. My name is Divine James, and you are watching Main TV.